Hi there. My name is Liz Dion, and I am a student coming into the Center for Integrative Medicine next spring. So I just wanted to introduce myself and say hi, like a little early, because I have a couple of questions that I'd love to ask you at the end of this video, so that I can start preparing for my time with you guys and make it the most meaningful possible for everybody. So just to start out with introductions, my name again is Liz. I'm a graduate student in the Occupational Therapy Doctorate program, and I'll be completing my final capstone experience for graduation with you guys next spring at the Integrative Medicine Clinic. Dr. Welsh is my wonderful mentor, and I've been lucky enough to be placed with her, and we've been cooking up some fun ideas. But about myself personally, I'm originally from Vermont and I adore Columbus. It's been really fun living here so far, but I was a massage therapist and a yoga instructor before I came to OT school. My favorite clients were homebound with various impairments such as like Alzheimer's disease or physical impairments. We would do yoga and things together in the home, so I always enjoyed that. Outside of professionals, I currently have a 2-year-old therapy dog in training. We're hoping that he gets there. His name is Rumi, and he's named after the mystic poet. Before COVID-19, I was working a lot with him, and then working at Vertical Adventures as well as at school. So at Vertical Adventures, I was a pre-K and adaptive climbing coach. Had a lot of fun over there. Hoping that after post-quarantine life, we can get back to it. Personally, my highly rated values are community, honesty, real connection, awkwardness, joy, playfulness, and balance in life. So again, I'll be with you guys January 13th to April 9th next year, 2021. We haven't totally figured out telehealth or in person or how that's really going to look. The group that Dr. Welsh and I are looking to run, we've decided to do telehealth, but we will see what happens in the world between now and then. So just backing up for a second, because it's a really common question, what does occupational therapy do? How on earth does this fit into the integrative medicine clinic? So occupational therapy works in a ton of settings, and we're obsessed with restoring function in patients and activities of daily living. So things like being able to feed yourself, dress yourself, just communicate, socially engage, prepare your food, everything that goes into your day. So we do that because we want to increase independence and well-being, as well as quality of life and overall health outcomes for patients. We love being team players. OTs are generally really creative, and we want to come up with fun solutions to any problem that might be going on and any barriers that patients might be having. So we love working with other healthcare professions, and I hope that we can develop a really fun relationship to enhance the client care that you're already giving and doing a wonderful job at. You might be familiar with occupational therapy with things like spinal cord injury, traumatic brain injury, stroke, autism, and such. We specialize in a ton of areas such as like hand rehabilitation or vision rehab, and some therapy like acute care settings, feeding and eating, strengthening, environmental modifications. We do primary care, mental health settings, geriatrics, among all sorts of other things. So we're all over the place, and that can get really confusing because different OTs do different things. So the OT program at OSU is really broad, really wants to prepare us to be absolute generalists. So we've learned a ton about all sorts of things. My previous clinical was at a school with kids with a lot of high needs, and then I will be at Grant Medical Center up until I come with you guys, come to hang out with you guys at the Integrative Medicine Clinic. So at Grant, I will be in the acute care, med surg, and ICU. So there's just a whole broad range of things, but we are using a lot of interventions like therapeutic activity and exercise, assistive technology, assistive devices, environmental modifications to help achieve patient goals. So what does this have to do with the Integrative Medicine Clinic? So my capstone project that I'm working on with Dr. Welsh is primarily based on identifying and addressing patient barriers to achieving their optimal health and wellness with you. I really want to work with each practitioner there to figure out what kind of resources and modifications might be able to help patients to follow the plans of care that they are trying to do at their home. Especially now with COVID, we're very, very homebound and trying to independently implement a lot of these suggestions. So there might be some barriers. I used to live with two ladies who are now actual doctors, but they were family medicine residents while I was living with them. And it really opened my eyes to how little time practitioners have in regular appointments with each patient. So these individuals are coming to your clinic with a list of problems, like a huge mile long, and they want you to be able to fix everything. But that's a lot, and you're a human, and we're all humans, and we're all just on this team together trying to help people. So they also might have, the patients might have personal barriers that are preventing them from being able to apply the suggestions that you're giving them in their daily life roles, routines, habits, and behaviors. So I come in being available to meet with patients for occupational therapy services in the primary care setting, which integrative med, modeling after the primary care setting, that we are going to discuss their individual barriers. Maybe it's something like their knowledge, their resources, physical limitations, the plans of care that they're receiving from various practitioners. Sometimes there's some overlap, and looking at all the plans of care that they're getting from everybody at the integrative medicine clinic might be able to find some ways that we can creatively simplify what it is that they need to be doing in their life, because they might be feeling really overwhelmed. And also providing some mental health skills training services in the OT realm. I'll be assessing patients' barriers and working with them to develop creative strategies for achieving their goals. This will be achieved through evidence-based OT interventions such as environmental modifications, behavioral training, patient education, USC lifestyle redesign, and motivational interviewing. So some really cool, fun stuff that I've been studying, and I'm really, really excited to talk about with you guys. If anybody wants to talk more about anything or have any resources for me, I would be super stoked to know about them. So to address mental health in the clinic, I will be connecting patients with local, or if they're going over telehealth, Ohio-based counselors. So kind of getting a feel for what counselors are out there and how to match people with someone who's going to be really good for them. It can be quite a process trying to find the ideal mental health care provider. So also working with people to understand what their insurance allows them to access for a mental health care provider can be really confusing. So I am really excited to dive into what insurance they might need, or what they can access that they might not realize that they can access. The insurance world is very confusing to all of us, and not why anybody became practitioners, but a very important piece to be able to get our patients to access the right care. So for patients who are either in the process of finding a mental health counselor, or if there are patients that aren't particularly interested or ready to start counseling, but they want to learn some new skills, I will be teaching focused acceptance and commitment therapy. It's a program that was developed primarily for primary care settings, and it just kind of uses these short little metaphors and exercises that teach people various things like grounding and values, and ways that they might be able to address some of the mental health skills that they might be lacking, and internal resources they might be lacking. I will also be teaching basic things like yoga, breathing, meditation skills, all at kind of a basic level, and individualized to whatever it is that different people need, and looking to really develop that relationship with people, that it's not me just preaching at them. No one wants that. They want targeted services for whatever they're dealing with. So that's a whole lot. It's really cool stuff. In addition to the OT services that I am looking to provide and explore with you guys as practitioners, with Dr. Welsh, I will be co-facilitating a specialized evening group for individuals that are experiencing chronic pain, comorbid with anxiety and depression. So Dr. Welsh and I will be focusing on diet, sleep, and exercise education and creative solutions for those. This program will include short exercises in that acceptance and commitment therapy that I was talking about a second ago to address the mental health portion, because as you guys know, body, mind, completely connected, all one. So I would love to answer any questions that you guys have. It's no cost for patients to join this program. And we're really excited and ready to accept new members. But as for this email right now, we're just focusing on, I have 3 questions that I would absolutely love if I could hear back from you guys to start understanding what I can do to prepare for my time serving you in January, which is so exciting. So what exactly is it that I want from you? I really want to help find the sticky spots that your patients might be running into when they're working on implementing your professional plan of care. This might be different barriers that they don't get to talk with you about in regular appointments generally, but you might feel are there and you don't have time to address. Things that might be holding them back from further success that you want for your patients. So for these questions, I'm happy to either schedule a Zoom call or a phone call with you, or receive written answers via email would be fabulous as well. Just really looking forward to hearing back from you guys. So now for the questions. I don't know why I did that. So number 1, what are your patients having a hard time doing? It might be things like implementing the healthcare suggestions that you're giving them into their daily life and habits and roles, understanding the information that's given to them. They might have problems like gaining the motivation to make these changes. Maybe they're feeling super intimidated by the volume of things and the tasks that they need to do to manage their healthcare. And then our question number 2. So that was, what do your patients have a hard time doing? What are you seeing is hard for them? Um, and then number 2, what information is it that you feel like a broken record? What is it that you find yourself repeating to patients day in and day out constantly? Maybe it's something that you tell all your patients, or it's something that a select few patients just don't seem to really grasp in their sessions, and you tell it to them again and again and again and again. There might be something there that's preventing that from really being achieved. So what do you find yourself talking about all the time? That maybe if like each patient just implemented this one thing, it would really, really make a huge difference. Okay, and then number 3, so on to our last question. What barriers do you see in patient health? So these could be limitations and barriers to like financial resources, physical resources, not understanding their insurance coverage or not having enough of it. Their health literacy might be low. Their mental health might need some help out a little bit. Stress levels might be high, time constraints. Some COVID-19 issues might be coming up that are just total barriers to your patients being able to find their best health. What is it that you might see in the clinic or otherwise that really is hard? So these 3 big questions, what do your patients have a hard time doing? What information do you see yourself repeating constantly? And what barriers do you see to patient health? So feel free to take some time to think about these questions. I'm really looking forward to hearing your answers and starting to brainstorm and collect resources and materials to prep for my time with you guys and your patients. Thank you so much for taking the time to meet me, virtual meet me, over this video. I'm really excited to get to know all of you guys and work with your team for a little bit in the spring. I'm super excited to have the opportunity to be at the Integrative Medicine Clinic, and big thanks to Dr. Welsh for taking me on. I can't wait to learn a lot from you guys and develop some ways to support your clients and your practice while sharing any OT knowledge that I might have that might be helpful, and collaborating a ton. So again, thank you for watching, or if you read instead, I guess you wouldn't really get to this point then, but or reading or whatever you're doing. I really can't wait to hear from you. I added my phone and email to, or email address to this email, and yeah, just looking forward to hearing from you. So thank you so much again for your time. Bye.